Good afternoon, Barbadians. As we address you this afternoon on a review of the country's COVID response, taking to mind the period of pause which we've been into since the 3rd of this month. With me this afternoon are the Honourable Prime Minister, Mia Motley, the Minister of Health and Wellness, Lieutenant Colonel Jeffrey Bostick, Dr. Anton Bess, and also Dr. Corey Ford. At the onset, I must say that we've received some very sad news over the past 24 hours. An activity and an event that we've seen several times on the major news channels, where we have seen frontline workers and indeed doctors and nurses passing from COVID and the responses of their colleagues. Regrettably, over the past 24 hours, we in Barbados have now experienced the passing of our first frontline worker from COVID-19. It occurred over the past 24 hours, and indeed we are, like the rest of Barbados, very grieved about it, very concerned about it. We know the effects that it can have on her colleagues and indeed those working on the front line and indeed at our isolation centres and at the Queen Elizabeth Hospital and other health facilities. This in mind, I want to express and extend our sincere condolences to her family, to her friends, and indeed her several colleagues at the QEH. From all reports, she was indeed a dedicated and hard-working nurse. I'd like, before we start this business process, to ask for 1 minute silence in honor of this dear lady who happened to succumb to COVID-19. May she rest in peace. Barbadians, today we're going to review, as I said, the period of pause. Review the effectiveness of this period of pause as it relates to our control and containment of COVID-19 in Barbados. We'll report on new clusters that have occurred in the country. We, of course, will speak about our contact tracing. As it relates to the new clusters, I think many of you will be aware of the matters related to care of the elderly facilities, and there will be an update as it relates to that and other institutions. We will speak of the contact tracing and how successful it has been. We will indeed speak of the capacity of our isolation centres and where we are with that, and of course the metrics as it relates to the R number and positivity. As we know, these are very important matters. As it relates to the matter of the Seek and Save, I will speak briefly at this point in time. Suffice it to say that thus far we have covered over 62,000 households in Barbados, and that we've identified 168 suspicious households, and that yesterday 236 rapid antigen tests had been done, along with 197 PCR tests in those households. Thus far, we have had 18 positive test results out of 218, which is positivity in that and Save and Seek of 9%, which I will speak to later. And of course, I will speak a little later in terms of our number and the positivity. But at this point, I want to hand over to Lieutenant Colonel Jeffrey Bostic to speak in terms of the numbers so far, in terms of our lab testing, the issues with the lab, and what has been happening in these various geriatric facilities. Minister Bostic.
Thank you, Minister Walcott. Good afternoon, ladies and gentlemen, members of the press. I'm really happy to be here with you today to give a situational report as to what we have been doing over the last several days, particularly relating to the period 3rd of February to the 14th part of the lockdown period, the pause period. You would have recalled that when I last spoke to you, I had indicated that once we had reached the level of community spread, and certainly with 200 cases in the 2-day period, that there will be more cases to follow for a while, because that is the nature of this activity. I would have also said to you that even though we were at a stage of community spread or community transition, that did not, and it still does not mean that it is not reversible. And we have been working very, very hard every day, day in, day out, to ensure that we reverse this trend. I will start by giving you some figures, and I know you would have been accustomed to the dashboard, yes, and that we would have been giving out statistics on a daily basis based on tests performed at the lab for a particular day. But I'll say to you that from the 3rd to the 14th of February, this is the data is for that period, the lab would have received a total of 8,395 samples, and they would have conducted or completed 6,560 tests. Out of those tests done, we had a number of positives, obviously 628. And what is interesting is that when we look at the SHAPE app, this is the app that most of our testing sites are using, and we get real-time information. Out of the 567 of the positive cases given by the SHAPE app, 401 of those cases we were able to attribute to contact tracing, and they were actually primary contacts. So 70% of the positive cases between the period 3rd and 14th of February resulted from from contact tracing and primary contacts. And this is important because I would like to explain to you, I know sometimes when we give results and you see a figure like yesterday, 207 positive cases, that may be startling to the average person. But those results would have been an accumulation of samples over a period of time, and the results were given when those samples were tested. And as far back as the 1st of February, we would have been receiving some of those samples. So that yesterday we would have had 1,222 tests completed with 207 positives. But of those positives, 111 would have been during the period 1st to 7th of February, or the first week of February. And this is because we've been experiencing some issues again in the lab, as we have explained on several occasions. And I'm going to take a little time to go into this because I know that you may get tired of hearing of issues and problems. But this is the real world that we're living in. And we are not the only country that is experiencing such difficulties. We are not the only country that have had issues in terms of sourcing equipment. We had to pause a bit in the lab because we ran out of a reagent, the reagent for the automated processing of test results. And the Prime Minister would have spoken to that on more than one occasion. I would have done so as well. And that is not because we were negligent at all. In fact, we would have ordered these kits in September last year, as well as October last year. But up to now, we've not been able to receive or obtain those kits, and that is after several telephone calls. This is just the way things are in terms of the shipping routes and supply chains as a result of COVID. But we've not sat back waiting on these supplies. We've done some of everything that you can consider. We've checked with other sources, other countries, private sector contacts and others. And I can tell you that we even had a person in the United States who sourced some things for us, and when we thought we would get them, there was an intervention that did not allow those supplies to come to us. The last thing we did, and we were certain that we were going to get samples, and the reagents, and they did arrive. I remember waiting up until 2:30 in the morning because I wanted to hear that they had arrived in the lab. And once again, we were disappointed because the reagents comprised 5 different solutions or bottles, and when they were opened in the lab, there was one solution called a binding solution that was missing from all of the boxes, and so the lab was unable to use those reagents. Thankfully, there was 1 bottle of that reagent left in the lab, and that is why for over the period of about 2 or 3 days, we were able to do about 4,000 tests using that 1 bottle. We've tried some other sources, and I can tell you that we are going to get a few of them today with the assistance of the regional security system. They will be traveling to Guyana today to be able to bring some of those binding solutions for us. Other than that, the company in the United States apologized for the error and actually made arrangements to get those binding solutions to our consulate in Miami. We had a tracking number and everything from FedEx. We had a Barbadian who was due to come home on Saturday and delayed the flight to come in on Sunday so that that person could bring those solutions in. But the weather in the United States, in Memphis, where FedEx's large distribution site is, they have not yet left that site, and FedEx is telling us that they should arrive on Tuesday or Wednesday. So those are some of the challenges that we've been having. But in the war, there are challenges, there are obstacles, and we continue fighting. And that is what the Ministry of Health and Wellness has been doing. There are several hot spots that we were covering during the last 10 days or so. You would have recalled that we had some issues at the geriatric hospital, and I can report to you now that out of that situation, we started with an initial case, that there have been 5 additional cases, 2 kitchen staff members and 3 nurses, asymptomatic. We've done a lot of testing at the hospital. All of the clients or patients, as you might better know them by, have been tested, and more than once, and they're all negative. And the staff, the remainder of the staff, except for 20 who we are waiting tests for, they are all negative. So that the kitchen, which was stood down and sanitized and everything, is going to be back in operation from today. And I give my sincerest appreciation to the entire staff at the geriatric hospital for staying the course and to have done what they've done to look after the clients at the hospital. So we are comfortable with where we are with the geriatric hospital at this time. We also had a situation at a homeless shelter, and this was some cause for concern, as you can appreciate, where we had 1 positive case. We moved in to that situation quickly. We appointed one of our public health doctors to be responsible for that response, and I can tell you that all staff and all of the persons who were residing in the shelter have not only tested negative on the first PCR test and the antigen rapid test that was done, but they have all tested negative on the second PCR test, and I believe should have been released from quarantine by now. We've had activities at 2 senior citizens' homes, and I would have mentioned this also without any details. But at Senior Citizens Home number 1, which is located in St. Michael, we've had 5 positive cases using the antigen rapid test. And then when we tested everyone with the PCR test, we got an additional 2 cases. They are all asymptomatic. And the positive cases, 5 of them would have been taken to Blackman Gollop initially from the antigen rapid test, and then to the Harrison Point facility. And the other 2 are also in isolation. There are no issues, no other issues associated with this particular home, and we are also providing assistance to the management of that home in the management of this activity. The other senior citizens home, which I will refer to as number 2, which is located in the eastern part of the country. This one was a lot more challenging, and there are a total of 31 clients who are positive, and 3 staff positive with the PCR test, with another 3 positive with antigen rapid tests, and awaiting the results of the PCR tests. Because of the peculiarity of this situation with several elderly people, and given the layout of this particular home, which is bigger than the average home, we've decided in collaboration with Dr. Corey Ford that we will designate, and we have done so, this particular home as an isolation facility because the majority of people there are positive. And we've taken control of the home for this period to help them to get out of the situation by utilizing resources of the Queen Elizabeth Hospital as well as the Ministry of Health in terms of our public health officers and medical officers of health. We've gone into the home, the infection control nurse of the Queen Elizabeth Hospital, and we have done a serious job of sanitizing the place and rearranging things so that we can do what we are doing at the moment under the safest of conditions. And that will be ongoing. We will keep on top of that. Dr. Ford has been looking after that and visiting that as he does with all of the isolation facilities, and we are satisfied that we have taken the appropriate actions to be able to deal with that situation. So these are the things that I wanted to bring to your attention. Contact tracing is continuing. We are putting more resources on the ground. It is becoming challenging, of course, as we get more cases. And my last word that I would like to leave with all of us is that in this fight, in this battle, all of us must be prepared to experience some short-term pain so that in the shortest possible time, we can enjoy the benefits of the long-term gains. Thank you.
Thank you, Minister Bostic. And now I'm going to ask the Prime Minister, the Honorable Myanmar Motley, to address you. Prime Minister.
Thank you very much, Minister Walcott. And may I, at the outset, join with you and all of the others who are today mourning the loss of our first healthcare worker in this country. We just had a minute's silence, and I really do want to extend my deepest sympathy on behalf of the government and people of Barbados to her family, and to her colleagues. But I'd also like to say to you at the outset that I'd like to extend the sympathy also to all of the other persons, regrettably, whom we have lost since the start of this COVID-19 virus, but in particular during this last wave. It is unfortunate that COVID appears to envelop everything we say and everything we do of late. There are several issues that I want to discuss with you this morning, but I'm in touch with you enough to know that the hot button issues on the minds of many, and I dare say the majority of Barbadians, revolve around how we wrestle and how we defeat the real threat of COVID-19 to our existence as a nation. My keeping my ears to the ground suggests to me that you want to know how we are doing. You want to know if the national pause achieved the desired results, and whether it will be suspended on February 17th as currently scheduled, or whether we're going to have to extend it by a few days. You want to know, or you would like to have the recent increase in cases, including the rise in deaths, explained, and Minister Bostic has tried to do that for you just now. And you want to be sure that the challenges that we've experienced with the testing at the lab are now behind us, and that we have now the adequate stock and supplies of needed, not just the test kits, but the related testing agents, as we have mentioned in the past. I know also that several of you are concerned about the impact of this current national pause on our economy, and indeed that the prognosis for Barbados of a further hit, what would it be should we decide to extend the pause or to stop? I understand your concerns, believe you me. And I understand the views of those who say we should reopen the country and seek to master the art of living through COVID, as from all indications, COVID will be with us for a long, long, long time. I understand what they say when they say that. I understand the impact of the diminished economic activity on your ability to keep businesses open and to keep them functioning. I understand the practical implications and the ramifications of our having to institute a mandatory 5-day quarantine period for all persons entering Barbados. Trust me, I get it. But last March, when we recorded our first positive case of COVID-19, I spoke to you then and I told you that this is a national health emergency. Of course, we know it is a global one too. As of December 2020, the country was on course to be able for us to deal with economically all of the challenges that we faced last year. And we did lose, on average, about $7 million a day during the course of the first shutdown. The amount that my advisors are telling me now that we are losing in this shutdown is slightly smaller because there has been diminished economic activity generally. So that we know the real costs of this, believe you me. But I want to remind you that as we walk this road, we're not walking this road alone. People asked us to suspend flights from certain countries because they have all experienced or experiencing what we are going through here in this country. And the bottom line is, we all know what the circumstances are in the United Kingdom, across wider Europe, where they too remain generally in lockdown. They hope that they can ease it within a month, 6 weeks, but they are still very much in the middle of fighting it. In the Caribbean and in the United States of America and in Canada, all of us see the information on a daily basis. And we know that there is virtually no place, this part of the world, that is able to withstand it. And even in Australia and New Zealand, in recent times, in Auckland, they found another 3 cases and have gone into lockdown. In Melbourne, they had instances with respect to a hotel, a Holiday Inn hotel, I believe, that led also to lockdown. My friends, no place and no one has been spared with the impact of this deadly virus. And your sensibilities are even being further attacked when you read in the newspapers again the impact of a likely or the existence of an outbreak of Ebola in Guinea in Africa. It is the last thing that our brains and our senses want to hear. I warn you, however, and I listened to Dr. Corey Ford, and I want to commend him publicly for an excellent job on Saturday night in communicating the very real challenges that our health workers are facing on a daily basis. When I spoke to him Saturday morning, it was my judgment that what he was saying to me needed to be shared with the entire country and not simply with me as your Prime Minister. I want to thank him for doing it, and as he said, for speaking in real terms, because that is exactly what he did when he asked us to stop and to ask us whether we really need to go to the supermarket for that extra thing, or can we do without it? Is it worth taking the risk? When he asked us about people who just want to go to the gas station and going just to get out the house, is it really worth taking the risk? And the answer, we all know, is that it is not. So where does that place us today as we get ready to face what would have been the end on the 17th of February, hopefully to resume normal activity, or some greater level of normal activity, I should say, on the 18th of February? We've done reasonably well, reasonably satisfactory as a country to contain the threat and impact of community spread in our country. We are not yet where we need to be. We were unfortunate, as you heard from Minister Bostic just now, to have experienced a malfunctioning with respect to our testing processes, simply because reagents that were ordered as far back as September 2020, 4 months ago, 4.5 months ago, still not available from the manufacturer as I speak to you today. And we were able, therefore, to ask our diplomatic offices as well as friends of the country over the course of the last 4 weeks to scour the world to be able to find these reagents. I have said consistently to this country that we have been facing market failure with respect to this pandemic, and that countries such as ours are regrettably at the mercy of larger countries because our orders are just simply too small to excite most people, and that's the reality. By the same token, we were able to be successful, as you heard from Jeffrey, and we were able to get some of the supplies advanced to us on Friday morning, 2:30, but regrettably, a key liquid, the binding agent, was missing. Our efforts to get that binding agent in spite of the very, very grave, very, very serious issues that we face without having it, have been compounded by the storms in the United States of America, so that when you heard Minister Bostic say that we had someone on standby to bring it in, literally yesterday, that did not materialize because the agents did not reach the Miami consulate in sufficient time. We took a decision last night to ask our brothers and sisters in Guyana again, and indeed the RSS, as I spoke to Minister Walcott before coming into this press conference, the RSS plane is leaving Georgetown as we speak and should be back here this afternoon, which will then ensure that we have a seamless continuity from the dregs that were found in the bottle that Jeffrey referred to that allowed us to aggressively go after testing once the rest of the reagents arrived on Friday morning. So my friends, the immediate nature of our being able to continue the testing program has been resolved. By the same token, what we did and used the opportunity through 3 different suppliers is to ensure that we have bought as much as we can buy without compromising it with respect to shelf life. And to that extent, we expect that we will have at least 9 months supply of the automatic reagents. You will recall that I raised this with you the last time I spoke to you, and I told you that all we had was reagents for manual extraction. I also told you that manual extraction was torturous for the lab technicians and that it would slow us down considerably. We had hope that we would get it sooner, but once again, we are not, as I said, in a position to command the market, and hence we are where we are. That has led us and the Ministry of Health to begin to believe that our statistics really need to be able to be given space to breathe. And much of the statistics you've therefore received in the last few days has a large component of backlog in it, as you heard from Jeffrey. We are therefore adamant that we would like to be able to see how our statistics do with respect to the testing and the testing rates and the R rate, and Minister Walcott, who is a surgeon, and Dr. Bess, who is here for the question session, can better answer those things for you. But as I understand it, the R number is simply that number of persons that will be infected from one person who has the virus with respect to the transmission. And indeed, many Barbadians have been speaking about both the R number and the positivity rate, which is simply the percentage of tests that are positive that we do. That is compromised by not being able to do the testing in the way that we expect to do it on a daily basis. I trust and pray that after we work on the backlog, and Jeffrey gave us the backlog just now, which is roughly about 1,600 tests, which we expect to be able to work off in a 2 to 3 day period, that we will then be able to get and keep current as we are hoping to do. At the same time, I want to remind us that the public health personnel and BAM and other health professionals have all expressed their views to me and to the cabinet. And generally there is a belief that we need to continue doing what we're doing, continue, in fact, more than pausing, as you heard from Corey on Sunday night, that we really need to stop. And that I would have told you on the last occasion that this virus don't play. You cannot cheat in diet, you cannot cheat and win the battle against COVID. And we're going to come to that in a minute, but I wanted to let you know that what is before the government today are very, very clear recommendations for an extension of the period that we have, and at the same time, against that background, a desire on the part of the private sector and Setusab to be able to have us open back up. This is not an easy decision that we've had to make. I met this morning with my finance and economic team, and I asked a simple question: can this country withstand any further extension of the period of pause or stop, as we are now hearing from our public health officials? The simple answer from the finance and economic team is yes, that we will be hurt by any further extension, but it will not kill our economy and it will not collapse our economy. I used the opportunity on the weekend to have extensive discussions too with other officials regionally and hemispherically, including the IMF, and we're all agreed that the economic impact of the lockdown, while rough, can be withstood by the Barbados economy. The advisors have indicated to me that it is likely that we will come in at just under $78 million for the period of time for this first part of the lockdown in terms of loss of economic activity. In other words, any contraction. If we go for an additional period of time, just under 2 weeks, then the most that will be is probably another 70 million, 75 million. So that we are potentially looking at a loss of $150 million in economic activity for the month of February. But by the same token, it is less than we would have incurred last year. And this economy, because of the work that we have done since assuming government, in terms of the fiscal rectitude that we have displayed by moving from a deficit to a 6% primary surplus, and then this year being able to move back to a 1% deficit because of COVID, because of the reduction of our national debt through the restructuring, both in terms of the public domestic debt as well as the public foreign debt. We have the fiscal space there. It is not where we want it to be, and because of the contraction of the economy, the debt to GDP ratios will appear to have increased, but we all know that we were able substantially to bring down our debt in absolute terms, and that even if we have to borrow some now, it is still within our capacity to manage this economy. And finally, we have the foreign reserves, because we have literally now still over $2.6 billion as I speak to you today, and the truth is that that is more than 30 weeks of import cover, more than this country has ever had and is accustomed to having. So that the clear, settled view is that the economy will not die. It will be hurt, but it will not die. And that it is important to note that how we proceed in terms of the following of the protocols will have greater damage to the economy than simply keeping it shut for another 2 weeks or so. The bottom line is that our economy also is not just at the macro level. We are conscious of the financial uncertainty and also the development of nervousness on the part of persons who owe loans or mortgages. And to that extent, I have now asked Minister Ryan Strawn to work with the Committee of Financial and Economic Persons in our team to meet with the financial sector, banks, and the non-banking financial sector to address the issue of both retail and commercial mortgages and loans to allow individuals in Barbados to have a greater level of certainty over the next 18 to 24 months. What does this mean? In essence, that the same thing that we did for the country, for the government, we want to be able to do as far as possible for our businesses and our households. How do we keep people's heads above water? How do we keep them solvent? In other words, by addressing our debt as a government, we were able to create a space for the government of Barbados to breathe and to be able to meet normal activities and, thank God, to be able to face this pandemic. Can you imagine if we had to face this pandemic without resolving our debt and our foreign reserves issues? We wouldn't even know where to start. So that I've said to Minister Strawn, we need to meet with the financial sector and to ensure that we can put in place arrangements that will allow people to have their heads above water and to be able, as far as possible, to continue to service their loans and their debt obligations, even if it means reprofiling much of it because of the protracted period of time that we have had to deal with this fight with COVID. And for those who say it is a long time, may I remind you that in 1918 it went for 3 years, 1918, 1919, and 1920. Regrettably, this has gone for a year, but it is within our power to be able to work with each other to try to keep as many people alive financially and, of course, alive physically, which is why this dilemma between the advice of the public health officials and that which the private sector and Setu Saab would want us to take with respect to this. My friends, against that backdrop, we've also looked, apart from asking Minister Strawn to go and undertake this target, I've also asked him to have a conversation with the utility companies too, to ensure that for those persons whose cash flow is negatively affected, that some kind of arrangements can be put in place over a 3-4 month period, rather than being forced to pay everything in 1 month where no revenue was coming in. All of us are in this together. We also recognize that any extension would mean that the social protection programs which we are running, particularly those that are providing support to our shops and to our vendors, would have to be extended for any period of the lockdown. And we also recognize that we were in a position to purchase, as I said, vegetables and produce from farmers in order to be able to go separately. We will meet separately with the fishing sector to see how best we can assist them, but at this point in time, believe you me, we will not collapse this economy if we just hold on for a little while longer. I should tell you that there are green shoots of economic recovery globally, and we must have the confidence in the plan domestically to assure success. Only in the last week, my government met and agreed on a framework and the draft bill, which will now go to Cabinet for formal approval, for the establishment of a free trade zone in Barbados. Fortunately for us, export manufacturing, even during COVID, continues to hold its own, as well as some elements of domestic manufacturing. And indeed, they have been able to continue as we would have wanted, as far as possible, in a situation that is normal, as is possible at this time. The best program in the tourism sector, of course, continues to be, the tourism sector continues to be at the front line of all that is being faced, largely because travel has been one of the hardest hit activities globally. The best program, therefore, as we conceptualized it in September last year, has to be refined, largely because the circumstances within which the tourism sector are operating today have changed since September last year, and therefore we are, because of the cessation of flights from most of our major source markets, and we are therefore in the middle of discussions with members of the tourism sector to see how best we can help them keep their heads above water, and most importantly, to keep their product, their hotels open, because if the hotels become dilapidated during this time, then we will not be in a position to benefit from any reopening of the tourism sector when it comes. In short, our financial institutions remain well capitalized and liquid, and therefore, in simple words, my friends, your money is safe generally. Our agricultural output has increased during 2020, and our current trajectory suggests that we can have an increase in production during this year. Key projects by both government and the private sector will come on stream once we start full activity again. And you will be aware that during this pause, we've only facilitated Highway 1 and Vineyard, as well as urgent repairs of the Barbados Water Authority and other utility companies. We are asking to hold, yes, but why? Because we are satisfied that once we can do that, and once we can get the numbers down, once we can get our R number down, once we can get our positivity rate down, we then are in a position to resume in an aggressive way the normal capital works program that we had hoped to have to pick up some of the lack of jobs that were currently facing us last year. And what are those programs that we're talking about? Some are already very much functioning, like the restructuring and refurbishment of the old court system in Bridgetown. Opposite in Magazine Lane, the British American building will start soon. The welfare building on Country Road, which has been dilapidated for some time, work will also start at that, as well as the gatehouse at Water Authority, the School Mills building in Country Road. We know about the relocation of the residents of Rock Hall, and those houses and roads have already, I believe, the roads are in for one of the locations, as well as the first 20 foundations have started and should be coming out of the ground very shortly. We are also going to start we hope soon, the contract with the Chinese Complant Company with respect to the rehabilitation of the Scotland District roads, starting not just with the main roads, main highways, but also the community roads in the Scotland District, such as White Hill and others. I can go on and on. There is Golden Square that will also start. The Fairchild Street Market shall currently finish very shortly, and they're going to move on to both the river and to Baxter's Road. So that, in short, there is going to be a lot of economic activity. But what is the rub? If every day we have to stop and shut down a business, or we have to stop and shut a police station, or stop and shut a department of government, National Assistance Board, or any of the other departments, and all of the supermarkets or the hardware stores, or all of the entities that on a day we're telling people we have to shut today because we found X amount, and we keep sending poor Dr. Bess and others to go and talk to persons to keep the temperature down, because people feel that as long as one instance of COVID is there, everybody's exposed. And we've gone over it and over it and over it to tell people that there are ways to protect, and that's why the compliance has to change. And that's why we are looking for people to say, literally, that, you know, you have to be able to see how we can get in and out of this. But what does it require? It requires our cooperation. And that's why I go back to the point that you cannot cheat and win this battle. You cannot cheat and win COVID. And what is therefore needed at this point is genuine compliance by as many of us as possible. And I'm going to address a few things today as I go forward. But given all of that, given the decisions of the public health officials, given the recommendations and discussions with the economic and financial officials, we are satisfied that we're going to require a little more time to do what has to be done. Minister Walcott can speak to it in the Q&As, but he has already indicated that we've done, for example, just over 60,000 households in the Operation Seek and Save. And let me lay out, just for the avoidance of doubt, what the 6-point strategy has been at the outset of this. One, it was for us to do Operation Seek and Save, because we said if you have symptoms, if your throat sore, if you ain't got no taste in your mouth for food, if you've got other symptoms, you need to tell us, because so long as we can get to you early enough with symptoms, we believe, according to the doctors, we can save your lives. So Operation Seek and Save has done just under 2/3 of the houses in this country, and we are satisfied it will finish within another week or so. But by the same token, we need the full cooperation, and we need as many people home as possible so that it is as comprehensive a review as we can. Secondly, we continue the aggressive contact tracing, and you heard Minister Bostic say it's becoming difficult, but by the same token, we have to do it. One of the things that we are nervous about, and you know, I don't hide nothing from you, is that I need to know how many people stayed home while waiting for test results when we had the difficulty. We would say to people over and over, stay home until the results come. I would like to believe that everybody complied, but I'm not so sure that I can put my neck on a block for that. And I wouldn't encourage anybody to put theirs either. So that means, therefore, that we have to continue to reinforce that message. If you are waiting for test results, let the people who live in at you know, and try to keep to yourself. I'm begging you now. You understand? Because if you don't, and the results come back positive, then you would have exposed persons who need not have been exposed if you had kept yourself to yourself. And I accept that the difficulty with the reagents has made it longer for some people, but the good news is that now that we have all that we need, we should be able to get people's results to them within the timelines that we set at the outset of the year, and which, by the way, we were adhering to for the better half of the second half of January until we ran out with the reagents, Jeffrey, as you would have indicated. Thirdly, that we do, therefore, that timely lab testing, as I just said, that is the third component. The fourth one is a comprehensive vaccination program. Prior to a week ago, I could not speak to this in any real terms. But today we know that we have already, as of last night, vaccinated 2,863 people in Barbados with the first dose. Most of them will get their second dose, I'm being told, in 10 weeks' time. But by the same token, this is a commendable start for a country that really did not have a lot of stuff in place for a vaccination program. This week, we expect to see it considerably ramped up, especially with the inclusion of the vulnerable from today. As you would have known, I think most of the health officials and the security people were at the front of the vaccination program thus far. But we need now to continue the rest of those frontline workers while increasing those persons who have registered. Up to this morning, I was told that we had just over 2,000 persons over 70 registered and just under 1,000 persons between 18 and 69 who have already registered. But I must tell you that once we ramp up the public education program, we expect those numbers to continue even more. And why are they important? Let me stop for a second, because I, like you, I'm a layman. I am a scientist and a doctor. If we're going to get the R number down, it means that people either got to stop where they are and stop transmitting it, which means that don't come up underneath me. And if you do, make sure that both you and I have on masks. That's how we stopping that we sanitize it. All of those, and that's the fifth protocol that continues to remain, fifth strategy, that continues to remain as relevant today as it was from the beginning of the outbreak. But the other aspect of bringing down the R number is how do you reduce the susceptible population? Because if the person who has COVID can share it with persons around them who are susceptible, then I either have to reduce the people who got COVID as well as and to reduce the people who are susceptible. The people who have COVID, we're trying to reduce. The people who are susceptible, how do we do that? By increasing the number of vaccinations. Simple. There's no rocket science. If we can increase the number of vaccinations, then we will begin to wrestle this thing to the ground. Minister Walcott can tell you this morning, he raised with me that in Israel, they have reduced, I believe he said, by 94%, and I'll ask him to speak to it, the number of cases since they have comprehensively addressed a vaccination program in their population. And they have been able to do far more reopening of things as a result of that approach. So when you hear us talk about the need for a comprehensive vaccination program, it's not because we are trying to be difficult or trying to do things. This is for the benefit of people, and I keep making the point that it is unfortunate that there are some people who continue to create strife and trouble in this country. I don't mind people who genuinely have a difficulty with it. That's fine. But there are people who are using the social media to create mischief. What happened with that video with the Governor General of this nation is absolutely reprehensible. absolutely reprehensible. And the persons who did it should have the conscience to come forward and stand up and be counted for the unfortunate behavior trying to make mischief. And who are they making mischief for? They're making mischief for me, because I know enough sense to read and know to dismiss them. They're making mischief for Jeffrey Bostick or Anton Best, because he got enough sense to dismiss them. They're making mischief for people who just don't know better and whose condition, in the absence of a vaccination, could cause them to be one of the people who die in this country. And that is why I come here today angry with those persons who believe that they can continue to play politics and to play partisan behavior and to play all kinds of nonsense with respect to the lives of our people. Okay? And what are the facts as they relate to vaccines? I've seen all kinds of articles being shared. And when you check the articles either have been overtaken by other comprehensive data. And don't let us get tied up in a domestic geopolitical war between Britain and the European Union, between Pfizer, a German company, and AstraZeneca, a British company. Britain has vaccinated 15 million people with AstraZeneca. Jeffrey, how many dead? Anton, how many dead? We've got to stop this nonsense. And we have people in Barbados who need the guidance of their family, who need the guidance of their church, who need the guidance of their MPs, who need the guidance of all of us, of the media, everybody, in order to guide them, and of course their doctors, because their individual circumstances has to be assessed as well. But if we do that, and we do it well, we can bring down the susceptible population. If our susceptible population is adult population, is anywhere around 210, 220,000 once we take out the people under 18, can we reduce that through vaccination to less than 100, to 50,000 even, over the course of the next few weeks? And the government's intention, and we've been working, I told you last week, I'll work day and night to find it. Yes, we have gotten vaccines, 100,000 vaccines, before other countries, not only in the Caribbean, but globally. And we need now to recognize that this is part and parcel of the strategy to be able to bring down the R number. The R number, by PAHO's reckoning, I'm told is at 1.43. If we didn't have any measures in place, the R number would probably be at least at 3. We are trying to bring the R number under 1 and certainly to as close to 0 as possible. But for that to happen, no dictate from government can't make it happen. No edict from government can't make it happen. We need to be able to have as many Barbadians saying, I am ready. Now, because of that, we have gone out there to be able and settled different supplies of vaccines, because we know that 100,000, and even as we gave away a few thousand to our brothers and sisters in CARICOM, we know that that will need to be expanded. And as a result, what we've been able to do is that we have 4 different leads from the COVAX, which we've already paid for, and Jeffrey will tell you the money has gone for that. The difficulty with COVAX is that they cannot guarantee when they are going to be delivering and how much they're going to be delivering, so that countries have had to go out there and find their own way. We are thankful to the government of India, who gave us a donation for that first 100,000, and we are hoping that we can see if we can purchase some more from them. We also have another lead in terms of other purchases of AstraZeneca, and we also have on hold, awaiting the approval of the pharmacological committees, some vaccines from the Sputnik vaccine, whose performance actually has been exceptional, but we are still waiting for the WHO and others to approve that. And therefore, those are commitments that we have as opposed to expected delivery. We expect from the African Medical Supplies Platform, Barbados' ratio in there is 55,000 out of 1.5 million potentially for CARICOM, and we are waiting to buy some of that, and in that we will probably try to include a few Pfizer for those who, for whatever reason, may prefer and may have to deal with the different technology that AstraZeneca is made of. Bottom line, that we would want to be able to have these vaccines here so that by the end of April, beginning of May, that Barbadians who, or people in Barbados who want vaccines can get them. And I say that because citizenship does not determine infection. Infection is determined by whether I am close to you, not by whether you're a citizen of this nation. And there are residents here who are not citizens who will have access to the vaccines, because that's the only way we are going to snuff it out of our landscape. And that is our intention so to do. With respect, therefore, to the vaccination program, I really do hope that we will see a concomitant increase in the numbers of persons being vaccinated, as well as in the supply of vaccines. We do not have exact dates for the delivery of the other 4 sources, but we do know that we are pretty much around the corner with COVAX. In fact, I believe today WHO has approved AstraZeneca, in which case what you will have is the COVAX being able to deliver the AstraZeneca to the countries of the world who are benefiting from COVAX. So we expect to get something soon. With respect to the 6th aspect, I told you the 5th one is complying with the protocols: mask, sanitizing, physical distancing. You know it well. But the 6th one is enforcement. And for those who say that there's no enforcement in Barbados, just because we've been on pause and you're not seeing the courts working every day, do not believe that there's been no enforcement. Indeed, the Attorney General shared with me, when I asked this morning, a list of 30 charges. I'm not sure how many people, because 1 or 2 people have more than 1 charge, and they will appear before the law courts very soon. And those range from as simple as not wearing a mask to the more regrettable and unfortunate transgressions, which is selling, opening shops and selling, which is literally having limes or parties or birthday celebrations. All of those things is almost as if we ain't talking. And that's why I asked Dr. Ford to talk to the country Saturday night, because we need to understand what we are doing to our healthcare workers when we continue with this licentious behavior that does not cause us to stop and just recognize, just stop. As I told you, pause and reflect and renew your spirit. In life, all of us, if we were sick, we won't have a choice but to stop. So let me do it without feeling the pain of sickness. And that's the point that I've been trying to get across to persons. Let us do it without the pain of sickness. And for those who want to believe that we are using and who want to politicize this, there's no politics in this. And I want to be very clear. I told my members of parliament that they would not be involved in the distribution of the care packages. I do not want them anywhere near it, because it must go to every household in this country who needs it. I don't expect it to go into upper middle income areas. I don't expect it to go into Rowan's. I don't expect it to go into Sandy Lane. I don't expect it to go in literally to a lot of the upper middle income areas in the country and middle income. And that is why, even if there's genteel poverty, that's why there's the hotline for people to call if a house has been missed. But I want it to go to every house, because people must be able to eat in this country. And if they end up with a little more food, well, then they will make sure, I know Bajans, and they're going to make sure that nobody don't starve in the district. That is the Barbados that I know. And they're going to make sure that they use that food to feed as many people as possible. I'm happy to report that the Defense Force has said that by the end of today, they should have come close to distributing 30,000 packages, and that they've gone into every parish but not every district as yet. So I ask those of you who have not yet received to just hold tight. They're on their way. They too have been affected, regrettably, by a loss of soldiers, by persons, the numbers of persons who have had to be quarantined. And that is why I want to thank the service clubs of the country who are helping us, who have come in recent times to help us pack, as well as the Barbados Youth Advance Corps, and that we have decentralized a lot of the packing in order to make sure that there is not the congregating. But at the same time, we've asked also that we reach out to the churches and districts for volunteers, so that when the soldiers are walking, because we've lost some of the soldiers because of the quarantining, that they can help give out street by street. And it isn't a lot of thing. A street got 23 houses, you walk with 23 packages. You understand? And go house to house to house. Those families that genuinely have 8 and 10 people, you got to give them 2 packages. That's common sense. But those who trying to game the system, who getting less than, who they got 4 and 5 people in a house and want more than 1 package, don't do it, man. We need to get through this thing together. And we now have to depend on each other to get out of this. This is a national effort. It is not a government effort alone. And that is why I say, for those who want to make the point that this is about politics, out of an avoidance of doubt, The BDF gave the Democratic Labour Party leader and the PDP leader 500 packages each. That's fine, because nobody's to say that they were in any way ostracized or prejudiced. And that is why I met with them even before we met on the last occasion, because this must be a national effort. This morning, Bishop Adderley and I both took the vaccines again together, okay? And members of Parliament, irrespective of what, whether independent or PDP or whoever, will be given the opportunity. Members of the social partnership, everyone, because all of us are in this together. But it brings me now to another point. With the enforcement, don't let me get cute. What Chuck does say? And tongue too long. Too long. The amount of side windows that opening in shops, it got to stop. I stopped and tell one last week that this one is on me because I am a member of the COVID unit and I can't lock at nobody. But I'm sure that if the COVID unit come the next time, it ain't gonna be on them, that they will face the consequences. You cannot cheat and win this battle. You cannot. And I ask every Bajan now to be their brothers and sisters keeper. If the loss of a healthcare professional does not do it for us, then we have to look in the mirror and ask ourselves, who have we become? Who have we become? If we can't get tired of hearing about people losing their lives, who have we become? And what is the difference? There is none who can literally say that they are without some level of guilt in terms of dropping the ball. None of us, all of us at some point drop our guard. The problem is that COVID don't respect the dropping of the guard. It don't respect it at all. And therefore, if we're going to get out of this, I'm appealing to people to literally let us just chill, let us just stop, let us just do what we have to do in the next 11 days. The government will extend the circumstances, the restrictions, the pause, to the 28th of February. We will, however, open mini-marts Monday to Friday. There will be no opening of supermarkets on Saturday or mini-marts on Saturday or Sunday because we're asking people to just cool it and stop. Everybody does not have to keep running at the supermarket. I would have liked to eat something particular. If it's not there, let me eat something else. I would have liked to drink something particular. If it's not there, let me drink a little water or something else. And why? Because the people who we are saving are your family. The people who we are saving are your community, your neighbors. The people who we will be saving are the people who work with you. The people who will be saving are the people who go to church with you. The people who we are saving are our people. We're not doing this for any other country. We're doing this for us. And for those who feel that it is their duty to game the system or to play tricks or to do the things, I mean, I was so ashamed. I am fooling you. I was so ashamed between Kerry Simmons talking about people trying to claim 3 and 4 times for the same thing. We can fine you. Don't do it. We can fine you. The country too small. Or Dr. Ford complaining about people taking items from Harrison's Point. I beg you. It isn't even that I can't find the money to replace them. I may not find the stock to replace them with a lockdown. May not find somebody open with the sheets. May not find somebody open with the pillows. Let me pause and let me use this opportunity to stop and think about who we are and who we want to be. On the 2nd of January 2020, in this room, I addressed this nation and I asked us to come on a journey so that we could become world class. We have reached a bump in the road, but that bump is not a permanent bump. The bump is as long as we allow the bump to be there. And regrettably, as I said from the book that I read from Pope Francis, a crisis brings out the real us. It brings out the best in us. It brings out the ugliest in some of us. And we need to be able to work together to make sure that we can do this together. We also know, however, that, and I want to say this, that by far, the majority of Barbadians have been disciplined and have been determined to fight this. And I want to thank you I know that there's COVID fatigue. I know that we are getting tired of it. But we see some light at the end of the tunnel. And with those vaccinations, if we can vaccinate as many people as possible, we reduce the number of the susceptible population. If we can do that, the R number comes down. Y'all can ask Anton questions when we go into question mode, and he can explain it even better than I can. If we can do that, government can't go in Parliament and legislate that. Government can't go and tax that and make it happen. Government has to talk to each and every one of you. And let me use this opportunity too to deal with those people who want to create political mischief by talking about us using influencers or my pre-recorded voice going around the country. I would like for my voice not to go around the place. But you know what the bottom line is? That everybody in Barbados don't listen to radio, don't watch television, and don't watch and follow social media. So you have to reach people where they are. And reaching people where they are means going into every nook and cranny. Hence Operation Seek and Save. Hence the audio recordings going into the thing. And then hence finding the people, and I see some of you in this press conference, who can reach other people that many of us cannot reach. And that is why you use artists and sportsmen and different people to carry the message. And it's not just here. There's almost every company in Barbados, every media house in Barbados, everybody at some point uses somebody to influence behavior, because that's the world in which we live with respect to social media. So let us recognize that, yes, we are trying to get everybody, and I quite frankly would like every Bajan now to be an influencer for the positive and to be able to get people stop and cease where you are, settle where you are for the next 11 days, and let us ensure that we can go forward. The exceptions, as I said, will be one, mini-marts will be allowed to open from Monday to Friday, and that is because we also expect many of them to also help with the cashing of checks for old persons' pensions. The Director of Finance and Economic Affairs would have said to the country that we are in a position where, for example, where the pensions will come out 2 to 3 days later. Minister Abrams will speak to you tomorrow or Wednesday with respect to the arrangements for the pensions and the checks that will be cashed. And the post office will also reopen on Thursday. We do not want people to run and bunch up and get things out. And that's why we're also opening the mini-marts, because we know a lot of mini-marts and a lot of supermarkets cash checks in this country. The good news is that because we've done a lot of deposits, lodgement as they call it, into people's accounts, the number of NIS checks has dropped significantly, and therefore we will work with them as we go forward. So mini-marts, post office will be open, and other Western Union type financial transactions, post office and other courier companies that are delivering critical supplies for people in the country. Those are the only exceptions at this stage. I've heard everybody. I heard about the extensions for the beach. There's anybody who would love to extend the beach more than me, but it can't just happen. And I want to remind persons, if you start, and I've asked for the COVID monitoring unit to be assigned to beaches too, because if people are going to gather and jump up and go up underneath one another, I will come back here and shut it down. I don't want to, because we accept that vitamin D and salt water are good for people and outdoors, but as Corey said, for people who are exercising generally, don't do it in groups. For people who are swimming, there's enough ocean out there that you can keep good distance, but don't stand on the beaches up underneath one another. I'm begging you, because we can make it if we really try. But we have to try, and we have to ensure that literally, that we don't cheat as we try. Over the course, therefore, of the next 11 days, I hope that the statistics will allow us to get a more accurate picture with respect to the testing that we're doing. I believe that as a nation, we are now today far more conscious of and far more responsive to the needs and the vulnerabilities of our seniors and persons with pre-existing health conditions. But as you've heard from Dr. Ford too, there are some younger people who are being affected. So let us not believe that we can just get in and out of this just so, and that we really need to pay serious attention. Let us give this, my people, our best shot. Because if we do that, I'm satisfied that we can come out of it stronger. And if we can vaccinate as many Barbadians as possible, as many people as possible living here, then we are in a position then to ensure that the susceptible population can be reduced, even though there's no guarantee on anything. We know that even after vaccination, that you'll keep wearing your mask, especially until there's herd immunity. And I'll ask Anton to speak to that in the question and answer so that there's clarity as to the protocols. Why? Because we're going to repeat and repeat and repeat and repeat so that people get it, so that there is no need to rely on persons whose agendas may not be the same and who may want to create strife. I ask people, and I end on this, how many of us have seen people with yellow fever or measles or rubella or any of those contagious diseases that we all receive vaccinations for? And the reason why we can even doubt the validity of a vaccination program is because we were fortunate enough to survive those outbreaks when we were children and in other parts of the world as well. The issue, therefore, must be for us to literally see how can we comply and remain on course to the 6-point strategy that the government has been adhering to. 1, aggressive contact tracing, as you heard me say. 2, the whole question of Operation Seek and Save to save lives, especially for those who are symptomatic. 3, the testing of the labs coming back to normalcy, particularly with the reagents, so we can get an accurate picture of the positivity rate as well as the R number. 4, that we have a situation where the vaccines are comprehensively delivered to as many people across the society that are entitled to receive it. It's still not for persons under 18, but for everybody else over. And as I said, if you have to talk to people, talk to your doctors, because your doctors will advise you. But there is too much internet fake news floating about this place. 5thly, adhere to the basic protocols. Face, mask, sanitizing, and literally physical distance. And finally, regrettably, enforcement. Hard as you want here, own way you're going to feel. And don't believe that there's any exceptions, because one of the shops I'm told is being prosecuted is in my constituency. And everyone shall face the consequences of their actions. And for all who believe that if I pass and say open again, I ain't giving nobody a blight. This time I call in the COVID unit far less anybody else. So I am telling everybody in this country, cut it out and let us get on with trying to get home as close as possible to a safe country for safe people in this country. I want to say that the image that comes to my mind is that we need to stop cutting with a blunt knife. All of us know that a dull knife or a blunt knife is hurt more and puts you at risk of infection. If we're going to have to cut, or if you have to do a sacrifice, as Jeffrey said just now, let us do it, get in and get out and get ahead with the mission at hand, which is to create a safe environment for the people of this land. With those words, I'll stop at this stage, but I simply ask us also to remember that this battle will only be won by the majority of people who find themselves on this island today, literally fighting together and in the same vein. And that means from the fellas on the block to the girls who want to really buy some hair but ain't got no hair to buy, to the people who would normally be going to church and not getting the chance to go to church, to the people who working and some who doing remote work from home still, to the fellas who would like to be out there in the construction jobs, we coming back to you soon, to the shopkeepers and the vendors, we're going to take care of you, believe you me. But we can do this together, because it is the absence of coordinated action that has most put countries at risk when there is community spread. So my friends, I ask you to listen to the professionals, and I ask us to stay the course for these 11 days. I hope that we will not have to do anything more, but I make no promises, because as I continually said to you, we will be guided by the evidence at all levels. And as you can see today, I've given you a longer address because I also wanted to let you know that this decision will not kill our economy. This decision might hurt us a little bit economically, but in the long run, if we can resume to normal, safe activity, you may actually find, as I was advised by the economic team this morning, that the economic activity will come back much stronger in the second half of the calendar year, they believe, if we get this point right at this point in time. But for me, I've told you over and over, there is no cost to a Barbadian life. There is no cost to any life. And therefore, to that extent, I cannot be driven into a situation where we are just ignoring what is happening and allowing persons to continue as if lives don't matter, because lives do matter. And that is why we have paused, and that is why we are now going to stop. Thank you, and God bless this nation.
Thank you, Prime Minister. And before I go to the members of the press, just for the benefit of all, Prime Minister referred frequently to the R number and also to the positivity, the percent positivity rate. The R number is simply a tool used by epidemiologists that gives a rating to infectious organisms, for example, coronavirus, in terms of the ability of that disease to spread in a society. That is, if one person is infected with coronavirus, how many persons is he likely to transmit that to in a population that is susceptible? And I say that, for example, I use two examples. In the case of measles, the R factor is 15, meaning that one person infected with measles could potentially, not in a country where there was no immunization against measles, could essentially spread that to 15 persons, and those 15 could spread it to 15. They have done the modeling for the coronavirus, and they've worked out that the R number is 3. That is, if I have the disease, I can spread it to 3 persons in a room, and those persons, once they contracted it, could then pass it on to 3 persons. You aim ideally for an R factor of 1 or less than 1. Ideally, probably 0.5 would be ideal. In terms of the modeling being done now, it is seen that our R factor is about 1.4, which means that it can spread in the society. It is a susceptible society, and all the more reasons why people must adhere to the protocols. Vitally important, the wearing of masks, hand sanitizing, and your physical distancing. As it's in terms of the positivity rate, that is a simple matter of the number of positive tests over the total number of tests and a percentage of that. And ideally, you aim for a percentage of perhaps less than 4%. And those are those two matrices that the Prime Minister referred to, the R number and indeed the positivity ratio. With us this afternoon, we have Mr. Shane Jones of CBC, Kerry Gooding of The Loop, Colvin Monse of The Nation, Ms. Wendy Burke of Starcom, Mitchell Robinson of Capital Media, and Randy Bennett of Barbados Today. Members of the media, ladies and gentlemen, you've heard the presentations from the Prime Minister and the Minister of Health and Wellness. Over to you for your questions.
Hi, good afternoon. Shane Jones from CBC. This question is for the Prime Minister. Prime Minister Motley, well, it is less than the number we lost last year, the amount we lost last year. You indicated that for the month of February, with now the extension of the lockdown, the country stands to lose about $150 million. Now, you said the finance and economic team said, well, it will be rough. We can withstand it. My question is, if after another 2 weeks, I guess I have a two-part question. If after another 2 weeks, we still are not where we need to be, what happens then? How much longer can we withstand? How much more of this can we economically withstand? And also, you mentioned that the mini marts will be opened, post office will reopen on Thursday, as well as places like Western Union. So that's a bit of a lessening of some of the restrictions. Will there be any tightening of the protocols to ensure that after this extended 2-week period that we are where we're supposed to be? Is any consideration being given to any tightening of protocols?
To begin with, Shane, thank you for your questions. With respect to the protocols, generally the protocols will remain tight and the level of compliance has to be monitored even more aggressively, and we have to have the enforcement of those protocols. That's why I mentioned to you that a number of persons, I'm told, are actually being charged very shortly. By the same token, we are really saying to everybody to literally tell, when you see somebody not wearing a mask, tell them wear the mask. When you see a fellow trying to open a shop on the side, don't go in it. and tell the others don't go in it, because that you don't know who next door to the shop or who in that community going to be the next one affected. This thing not playing? It ain't playing. With respect to the economy, our economy is far more resilient than that. And believe you me, even with the loss of the $150 million, look, at the end of December 2019, our economy was producing about $10.4 billion in goods and services. As a result of COVID, at the end of last year, regrettably, we'd lost about $1.5 billion. Now, that's why I go back to what we did at the beginning of our government. If we didn't spend the first 2 years literally stabilizing this economy, we would be in potter. We would be in serious trouble. But because we did it, when we look at the different indices that we have to look at, and what are they? One, do we have sufficient reserve cover to allow spending to take place without exhausting our reserves? We came to government and we had 4 weeks of import cover. We now have over 30 weeks. We've gone from 400 million to over 2.6 billion in terms of gross international reserves. Two, our debt was much higher. We restructured our domestic debt and our external debt. While we've had to incur debt again during the course of this year, it is because we were able to bring down our debt that we had some space. So let me use an example. I lost weight. If I put on weight and I lose 40 pounds, it means that if I have now and can only eat bread and cake for the next week because I ain't got nothing else to eat, it means I can afford to put on 10 or 12 pounds, but I'm not going back up to the 40 pounds that I lost. Three, that we also have a situation where we were trying to lose weight again at a certain level. We were trying to lose weight at 6 pounds a week, or 6 pounds, for argument's sake, a week. In other words, that we were looking at a 6% surplus, because if we are saving money, we are not increasing debt. Regrettably, we have to go back to borrowing, and we're going to borrow and run a deficit at 1% this year. And it was intended before this that we would go to a 2% surplus instead of a 6% for 2021 to 22. That may have to be reviewed, and that's the short answer to your question. And if we have to do it, both ourselves and the IMF have agreed that we will do whatever has to be done to keep people safe and to keep this country safe, and we will keep the receipts, and we will then have to negotiate with them. How do we take our debt and strength and our obligations to be able to reach a certain fiscal anchor, a certain debt to GDP ratio? Right now we were to reach by 2033. It may become impossible to do that in the same way by the same time without extreme severe policies. That obviously is not going to work, because if you literally lock off all the oxygen in a person, they're going to dead. And far from that, we want people to keep their heads above water. So that's why I've set up the committee with Ryan Strom to begin to have the conversations with the banks and with the finance companies to be able to see how can we, because this thing has lasted longer than anybody expected. They gave us a moratorium last year for 6 months. Some of them extended it. But we're going to actually have to go in more aggressively now and see how we can literally try to keep as many companies' heads above water and households above water in both commercial and residential mortgages and loans. Okay? So we can take more. Hold on. Just a minute, please. Just a minute. I know everybody anxious. I'm running away. What we need to be able to do is to ensure that we create as much space for individual companies and individual households in the same way that we created space for the government. So when we put natural disaster clauses in our bonds, it was to stop the payment of principal and to take the interest and put it at the back end so that we would have 2 years of fiscal space, 2 years of elbow room. We want to be able to do as far as possible, as much as we can do for businesses and households. And to that extent, therefore, once we can keep the macro fundamentals of our economy stable, then we can actually handle a lot more, Shane, than we're handling, even though the numbers may seem intimidating to some of you. I will ask members of the economic team and the financial team to continue to speak to the country during the course of this week and to explain to others so that people know that we got this. Trust me, we got this. And it's not just us. As you know, I chair the development committee of the World Bank and the IMF, and therefore I'm looking at it not only from the perspective of a small island state like Barbados as a middle-income country, but all countries. And I give you this last example. If we don't find a way globally not Barbados alone now, globally, of reprofiling, not restructuring, but taking the debt that we incurred for COVID and stretching it out to 40-year and 50-year debt and telling people that you don't have to pay interest, you get a moratorium on interest for 5 or 7 years, then we cannot resume the normal development trajectory, nor can we do the things that are necessary for us to fight off the climate crisis, which in the case of Barbados is access to water, access to protecting our reefs and to minimizing flooding and to dealing with the sargassum, etc. What was the example that we're using? You know, Britain went through World War II. You know that the only reason Britain could have rebuilt Britain is because they took the debt incurred in keeping above water for 6 years, 1939 to 1945, and they pushed it out into something called perpetual war bonds. And it meant, therefore, that they gave themselves the elbow room to be able to get access to other financing to build back Britain after a war. Now, if the world doesn't recognize that we need a space to resume the development, the trajectory to the development goals, which I've said is our development policy in terms of access to healthcare, water, education, all of the various things, but in our case, is compounded by the climate crisis. So, Shane, we can do it, but it does require being more precise with a scalpel than using an axe to cut across all of the things that have to be done to stabilize the economy. With respect to the sectors, as I said, each of the sectors, and we have new sectors coming out, renewable energy, Minister Simmons will make an announcement to the Parliament in the near future with respect to a feed-in tariff, a tariff for persons over 5 megawatts. Why? Because we need to be able to get some of the renewable energy investment going, and for those who are prepared to invest within the next 9 months and complete within 2 years, they will get the benefit of a better rate than those who come after. With the medicinal cannabis industry, as you know, the legislative arrangements are in place, and we're looking at an industry not just for Barbadians to be in joint venture as the law requires, but also to have some Barbadians assume responsibility for their own operations. We're looking at wellness within tourism, so that there are a number of things at the sectoral level that can happen. But none of these can happen well if we are having to shut down and to fight a pandemic at the rate at which we're fighting it with community spread. So that is why we're taking the action that we're taking.
Good afternoon, Prime Minister Motley. The question is pertaining to the various sectors. We had a situation where the vendors would have been given a stipend, and we've also been having calls for others within the small business to get some attention, barbers, hairdressers, etc. At this stage, can you tell us whether or not the government is in a position to offer additional help in the way of stimulus packages?
As I indicated, any extension that we do will see an extension of support to those entities, vendors, the shop owners, the barbers, the hairdressers, and the only one we didn't have a dedicated framework for, and we have to, are the fishermen and the fish vendors, and we have to work out and see what works for that sector given the thing. But for the other sectors, all of them are there. I know that over 1,400 people have received payments already, and they're still in the process of processing payments, as you know, because remote work still continues every day. Look at all of us, we're still working. Some of you are not at work, some of you are still at home, but doing your work from home. So we will continue. We are sensitive to the plight that every Barbadian will face. We've had to break ground. This country has never had to distribute food care packages in the manner in which we're doing now, because we've never had in modern Barbados to impose restrictions on people's movements. The curfew will remain the same, 7 at night till 6 in the morning. In other words, we do everything except what I've announced with respect to mini-marts and the post office and the Western Union type things. And why? Because we need a little more time to be certain. The worst thing we can do is to open back up fully and then have this thing, Jeffrey, lurch ahead of us in a way that truly becomes unsustainable. And I keep making the point about also the capacity of the healthcare system and the capacity of our healthcare professionals. I had a session Friday before last, with the Queen Elizabeth Hospital, where we had 800 people on the line with me and Minister Bostic and the management there. We were to have gone back again this last Friday, but because of the vaccination program for them, it was delayed. I hope that I'll get a chance to meet with them again, because believe you me, we are sensitive and we are appreciative. And that's why we are saying to Barbadians, cease and stop and let us take care of each other, but in particular those who are going out there to help us maintain a safety regime, as well as to help us provide medical treatment to asymptomatic and symptomatic Barbadians.
Thank you, Prime Minister. And on that topic of asymptomatic, I have a question quickly for either Lieutenant Colonel Bostic or Anton Best. You had sent some samples before to CARFA, and we found that we had the UK variant in Barbados. Have more samples since been sent, and have we found any other variants present in Barbados?
That's a great question, Wendy. So I would have had a meeting on Saturday with a group of us looking at issues related to the laboratory. And this included members of Barbados Association of Medical Practitioners. And one of the recommendations emanating from that meeting, which I would have presented to the wider AOC just yesterday morning, is that we need to do continuous, what we call genomic surveillance. So in other words, it was a one-off thing that we did 3 weeks ago where we sent samples to see what variant was circulating. But in order to know if that variant continues to circulate and to what extent, and heaven forbid if we were to get any other variants, we're now putting a program in place to do continuous surveillance. The CARFA labs in Trinidad and Tobago has said to Barbados that we can continue to send samples there. However, what we think is more sustainable and wiser is if we build capacity at the Besso Santos Public Health Laboratory to be able to do it on our own. So we are exploring, and as we get more information and more definitive plans and timelines, we will share that with the public.
I should tell you, Wendy, to add to Anton, because he wouldn't know this. I've actually had meetings with Minister Bostic and Minister Walcott and the head of the Dos Santos lab, as well as identifying people who have masters in genomics, in order for us to be able to develop the capacity within our own lab going forward, as well as to do other interesting things that will be critical, because we believe that Barbados has a future in biotechnology and genetic engineering, but we need to get it right. So this has, in effect, pushed us in that direction, and I know that the lab has also a very close relationship with a lab out of Canada as well, who will continue to help us in this regard.
Good morning. Yes, Pavel Manzi from Nation News. Quick question for Prime Minister Motley. You would have mentioned that the economy can sustain a hit in terms of the losses over the extended shutdown. However, the business sector would have indicated the possibility of a further unemployment fallout as a result of this. The Minister of Finance would have indicated that quite a number of persons would have already exhausted their claims at NIS the certain number of weeks. What are the mitigating measures put in place for this?
Colville? Colville, I didn't know that
Yes,
I didn't know that I had spoken. Are you referring to Minister Strawn?
Yes, Mr.
Okay,
Strawn,
thank
yes. Yeah. Minister Strawn, I was referring to. Also, I asked a question for the health professionals. The nurse that would have died, I also joined in expressing my condolences. But do we have any other healthcare professionals that are in that severe state of illness at the isolation facility as well?
Dr. Ford? Dr. Ford, you're muted.
Good afternoon to Barbadians. I missed the last part of the question. Can you give me the last part of the question, please? I
Didn't know if there were any other health frontline persons who were quite ill at the facility.
Great. Before I even talk, I just will ask the nation to continue to pray for us and I thank God for every blessing that He's given us in this fight that we've had. I ask you, the public, to think, to act, and to continue to support us as we continue to fight this COVID battle. But to answer your question specifically, at this particular point, we do not have any other healthcare professionals who are gravely ill at this particular point.
That Colville asked me with respect to the economy. As I indicated, our economy would have contracted in nominal terms by $1.4 billion at the end of 2020. We expect it to grow this year by about just under 500 million. So that to lose 150 million will still potentially allow us to see growth, but by the same token, not the level of growth that we would have hoped for, if we get it right. If we don't get it right, then we may not see any growth at all. And therefore, do we still have room? Yes, we have room to do what has to be done. Do we want to use that room? No, we don't. Can we avoid using the room? If Barbadians work with us in a seamless way, then we can limit our losses to the month of February rather than expanding it beyond that, and rather than therefore threatening any expansion of output in this year, 2021.
Randy Ben. One question for Minister Bossett. There are reports that a community in St. Joseph has been quarantined. Can you share any information on that?
Thank you very much. That is certainly fake news. There are no communities in Barbados that have been quarantined as a result of contact tracing. None.
Yes, another question for the health professionals. The Seek and Save program, as you would have mentioned, would have found about 18 cases. Could you further break down those cases as to how many households they span over, and which community, if possible?
Mr. Monzi, I respond to that one because I've had responsibility for coordinating the Seek and Save program. You are correct that up until yesterday there were 18 positive cases. They have scattered across the island. We found some in Christchurch. I'm going to give you constituencies. I'm not going to give you areas. In Christchurch, West Central, we found 4 cases. In St. Philip North, we found 2 cases. In St. George, there were 2. I think there were 3 in St. Thomas. In St. Michael, in the western part of St. Michael, there were 3, and I believe another 3. So they are dispersed throughout the island. The good news is that we have not found, certainly in this Seek and Save, we have not found cases, and it's continuing, in St. Lucie, St. Peter, St. Andrew, St. Joseph, St. John. You found, I would say then, St. Michael, as I said, Christchurch, St. Philip North, because St. Philip is a large area, St. George, St. Thomas. The project continues. You might be aware that it not only entails students going around doing a survey, but it has a phase 2 of it, which comprises a number of health professionals, paramedical people, doctors, and nurses involved, where the UE, there's the collation of data, is the filtering of data according to the specific symptoms. You recognize that we're doing COVID and also looking at dengue symptoms. We zoomed in on COVID in this response, where there's then a telephone evaluation for those, a number of persons did give telephone contact numbers, so the doctors are able to do an evaluation to reduce the number of, in terms of suspicious cases. And then another group goes out. We have about 6 teams, testing teams on the ground that go to various parts of Barbados, doing the assessment, doing the swabbing, and of course, validate swab there and then for the rapid test, which is done on the spot, and also a PCR test, which is submitted. Those who are positive on the rapid test are transferred immediately, almost as soon as possible, to the Blackman Gallup Center, so that we remove them from the community, recognizing that they're positive. Obviously, other people in the household are also tested then. And this program is going on as we speak. Earlier I said it had covered over 62,000 households in Barbados. Persons would have inquired about the additional information that was asked for. I think Colville, you recognize the importance of the social determinants of health. This has to do with your living conditions. If there's overcrowding in a house, if you identify one person that is positive, it means that obviously you can't quarantine the others in that house while they're waiting for results, because they will be primary contacts. That has to be taken into consideration. If there's running water, how is sanitation, etc., going to be maintained in the face of a possible positive case in that family? We look also at the incidence of non-communicable diseases in these households, recognizing the comorbidities related to COVID and the NCDs. And of course, we take into consideration the number of persons in the household who are over 65. Thank you.
Good afternoon, Carrie Gooding from Outlook News. I know that we would have received the 100,000 doses of the vaccine. I wanted to find out how much exactly is earmarked for Barbados, because we would have given away quite a few thousand.
Yeah, thank you. As you know, we received 100,000 vaccines, and I believe that the numbers that have been given away, and I speak subject to correction, is about 8,000 of that 100,000. But I think all of us know that we were brought up to know whatever little we got, we can share. And the truth is that we could not apply 92,000 vaccines in 1 week. And we have brothers and sisters in the Southern and Eastern Caribbean and the rest of in fact, I think we will send some to Belize tomorrow that need it. So we're all working with each other. And since making that commitment, we've actually been blessed with other doors and avenues opening up for us. So I'm satisfied, as I said, that we will continue to work to be able to provide vaccines on demand for all persons who need it once you're in Barbados. Because bottom line is that we need to literally reduce that susceptible population. And if there's no other phrase that you remember that. Because so long as we can reduce that, the greater the chance to bring the R rate down, the R number down. Okay?
No, in the subject of.
One second.
Excuse me, Prime Minister.
With respect to the vaccines that we received, the 100,000 doses, is it 50,000 of the first dose and 50,000 of the second dose? Because I think they're different. So,
yeah.
Could you explain to me?
We are reserving. Some countries took decisions to be able to spread out to 100,000 people all at once. We're not. And if you know me and you know this government, I am very, very cautious when it comes to certain things. And therefore, we go with the 50,000 people and make sure that those persons can have their second vaccine dosage before the expiry. I'm reasonably confident, as I said, we have 4 different avenues that we are working with to get more vaccines here. And I'm reasonably confident that most of those will work. And yes, it is. I don't think there's anything more difficult in my public life than having to deal with the market failures of the last year as a small person, a small nation. We saw it with ventilators, we saw it with PPE. We actually had shipments taken from us and diverted at that time. We saw it again and are seeing it still with the vaccines. The Prime Minister of Trinidad and Tobago, on behalf of CARICOM, wrote a letter to the Director General of the WHO, who I was in contact with up to yesterday again, and the Director General of PAHO, and I really want to salute both of them for standing with Barbados as we manage these crises. But Prime Minister Rowley would have written to the Director General of WHO asking for some kind of meeting to be convened looking at the issue of equity with respect to the distribution of global vaccines. And the truth is, even with that, as I said, we are lucky because the majority of countries and a lot of large countries have not gotten it yet. The majority of countries across the globe are still fighting for access to vaccines. So this is not easy, but believe you me, we are going to fight with every ounce of our body to get them for the people who are here.
While we're on vaccine, let me just jump in here. with a question that could either go to Colonel Bostick or Dr. Best. While I'm happy to hear that there have been over 2,000 senior citizens, over 70 that have already registered, during the Prime Minister's address, she said something that stood out to me, that people will be waiting to get their second jab in about 10 weeks' time. Now, why this stood out to me is because I have personally seen people who were already vaccinated and got their first shot have received return dates of some maybe 4 weeks or 5 weeks or 6 weeks. So I'm wondering, what is the reason for that, the difference, some people having 6 weeks and some people having 10 weeks, especially since initial studies have showed that the longer wait time, the longer gap between the jabs can improve the efficacy rate. What's the Minister of Health and Wellness position on what that gap should be?
Sure. So Shane, great question. Let me explain that the manufacturers of the vaccine that we received did recommend that the second dose should be anywhere between 4 and 12 weeks. But appreciate that the level of knowledge and the rate of new knowledge coming in is very rapid. So within the last week is when definitively WHO would have recommended that the interval time increase. So we have subsequently gone back to the planners and said, look, in light of this new information, how can we translate it into programmatic action? So we are relooking at the dates of the second dose that were originally given. Yes, we were given dates around 4, 5, and 6 weeks, and we're recommending that we increase that interval. So fantastic question, but we're on top of it at the Ministry of Health and Wellness in collaboration with the coordinators for the National Vaccine Strategy.
And Shane, I may well be a guinea pig, because I took mine on the 8th of January, first dose, and I've taken the second dose this morning. Health did say to me that they would have liked me to wait till week 10, and I said to them, when I told the country that I took the first dose already, there are so many people who went to start fake news to say that I never took the dose, including some people who should know better. So I have allowed myself to be a human living sacrifice if necessary. So I've taken the second dose this morning after 5.5 weeks, even though for most people it is recommended to go the longer date because of the efficacy, as Anton just said, Dr. Best just said. Okay?
And Prime Minister, while I'm happy here, because I know you want to get him, but I just want to get a follow with the Prime Minister. Prime Minister Motley, you would have made mention of some geopolitical battles. Everyone is watching, reading, trying to get as much information, because a lot of people are worried, scared, understandably so, about vaccination. It's not the most pleasant thing to think about. We have seen from some credible international mainstream reports about parts of the world that the Oxford AstraZeneca vaccine is being discontinued or banned or stuff like that. You made a passing mention of some geopolitical battles. Can you give us a little bit more about that, so people understand sometimes what they may read on, say, a CNN or BBC, that this place has banned the vaccine? Can you go into a little more detail about those?
Let me deal with the most, thank you. Let me deal with the most definitive statement. Today is what date? The 15th of February? Today, on the 15th of February, the World Health Organization is approving AstraZeneca, if it has not done so because of the difference in timeline already. The entity across the globe that is responsible for policy and health policy frameworks internationally is whom? The World Health Organization. The emergency approvals of AstraZeneca or Moderna or Pfizer were done by individual countries. But what WHO is doing today is a United Nations body effectively approving this vaccine for 7 billion people across the earth. They did it already, I believe, for Pfizer. And therefore, the bottom line is that that is the standard that we know, therefore, can be supported. With respect to a lot of the comments, because, and you heard Anton, Dr. Best say it again just now, because a lot is so fluid, people are saying all kinds of things, and the internet, regrettably, has democratized the uploading of papers and news and stories from all sorts. But that does not mean that it is all correct. Doesn't mean it's all wrong either. But you have to be discerning, and you have to be able to understand. And what has happened, regrettably, is that there are some people also who recognize that this is very much a commercial war and that this is very much a geopolitical war as well. So you're going to hear all kinds of voices and nuances coming at you, but all I ask us to do is keep our head on and to remain focused. 15 million British persons have received the vaccination. How many have you heard have died or have been seriously negatively affected?
Prime Minister, both questions are to you on vaccines. The Welcome Stamp Initiative, a number of individuals are here. We have some loyal Starcom listeners wanting to find out how many of those Welcome Stamp people will you be making the vaccine available to? And secondly, we had Senator Franklin today saying that he will absolutely refuse to come to Illawarra Court to have any vaccine done. Now, I know you would have given permissions, well, would have asked the senators as well as the MPs about taking the vaccine. Can you at this point give us any indication as to what percentage of that grouping have indeed decided to sign on to take the
I
vaccine?
can't, because as we speak, many of them are doing it. Secondly, I am not going to get into the narrow, petty politics of where persons take the vaccine. If Senator Franklin does not want a vaccine here, he's entitled to take it anywhere, any place, anyhow, or not at all. That is his personal decision. And I'm not going to be distracted in this conversation by persons who want to deal with petty politics rather than dealing with the fact that we are trying to stabilize a nation and to save lives.
On the Welcome Stamp?
Once again, earlier I would have indicated to you that this virus does not attach itself to citizens. It attaches itself to people. And therefore, once you are resident in Barbados, not a short stay tourist, but once you are resident in Barbados and will be resident to be able to take the first dose and the second dose, then you will get it. And why? Because we have maintained that we are going to work towards providing sufficient vaccines to have vaccine on demand for all who want it. I'm going to meet with the Rastafarian community later this week. I understand that some of them have legitimate concerns that they want to share, and I want to hear them as well as they hear my perspective too. And that will happen. But my fundamental point is this. Once the vaccines landed, and we knew from as early as last week with WHO that the SAGE committee had already recommended pretty much for its formal approval, and we knew that we had emergency approval in a number of countries, including the United Kingdom and India, etc., and the United States of America with the CDC, FDA, sorry, that we were in a position also because of our own assessment within the Ministry of Health to be able to use that vaccine. So we are satisfied that if we get enough vaccines here, we want to be able to give it to as many people who need it and want it who are in Barbados, because that is the way, one of the key strategies of the 6 strategies that I outlined to the country today yet again.
Thank you.
Any other questions?
Yes, I have one question for Minister Bostic. Right now, there are 23 deaths in Barbados related to COVID-19. I'm wondering if those deaths are recorded from persons only who have only died in healthcare facilities. I was wondering if any checks had been made or if there was any way to verify if persons dying at home would have possibly died from COVID-19.
Thank you very much. I'm going to ask Dr. Ford to respond to you because, as you are aware, Dr. Ford is the person who deals with all persons in isolation and all of these matters. So, Dr. Ford, please.
Thank you, Randy, for your question. In short, generally, unless there is a reason why we might believe that someone who may have died at home, either was it in the household where someone is actually positive, or had been in contact with someone positive, or had symptoms, and we look at the whole situation that would have done that, then we would have actually have done COVID screening on those individuals. We have done that in some cases, and of course, we have found them positive at this point. We've known that people being at home ill, and when they go to the emergency department, for example, and they probably died in emergency, at least in one case. And looking back in the case, we actually found that person actually was COVID positive. So if there's a reason to do that, then we would proceed to do that. If we look at the history, the contact, for example, those sort of things would allow us to make those sort of decisions. But this is a really great question. Thanks.
Question
May I
is
say,
for
excuse me, just for the benefit of the public, a person who dies at home has to have an autopsy done, and therefore, unless they're under doctor's care, and usually in a hospital environment, the doctor will be able to say what they suffered from. But once a person dies at home, our legal system kicks in. So that I'm saying that because I don't want anybody talking about any fake news or conspiracy to be able to keep numbers down with people dying at home. Barbados doesn't work that way. As soon as a person dies, the police comes to your house. The police also makes arrangements for the undertaker to take the body. And if the person died in circumstances where a doctor can't certify it within, that they've seen you within recent times, Anton, I can't remember the timeline, then you have to have the autopsy. So that's just for the sake of comprehensive information. Thank you.
Minister.
She was saying something? Well, Anton, you want to speak?
Yeah.
Please.
Right, so I wanted to add to the Prime Minister's response as well as Dr. Ford's response. We have had instances of people dying suspiciously in their homes. So in addition to doing the autopsy, what we have done, if we strongly suspected that COVID-19 was possible, we actually did do a test post-mortem. And in those cases, we found that persons were negative. So just to make sure that we're not missing any deaths in Barbados due to COVID-19, we investigate, as what Dr. Ford was saying, but we also do a COVID test if we have reason to believe that it was a possible COVID exposure.
And may I say to you that while talking, my PS would have sent me the formal report of WHO listing the 2 additional versions of AstraZeneca for emergency use today. And this comes, as I said, on top of their approval of Pfizer on the 31st of December. So let us be guided by the facts. Thank you.
Thank you.
Okay, my question. We're just now speaking about autopsies and persons dying, so funerals. There are some funeral homes are asking, especially now with the extension of 11 days, about getting lumber to make caskets. That's one question coming out of the Funeral Directors Association. And the second question is, some small businesses, persons who would have gotten loans through the Trust Loan Fund, are saying that they do not qualify for the 750. And I'm wondering if there's any reason for this.
I'm actually not aware why they've been disqualified, but I'll investigate it and get back to you. With respect to the funeral homes, any emergency use of any supplies in Barbados is handled through the application to the Attorney General for an exemption. We've had to do it in the past, and we will continue to do it. We did it last year, we've done it this year. We will do it on a needs basis based on the urgency of the situation. Clearly, being able to bury, regrettably, those of our families that have passed us is an urgent situation.
Good evening. This question is for Prime Minister Motley or Minister Bostic. This is regarding the efficacy of our national pause over the past couple days. I know the ministry has been managing a backlog of cases. However, is it safe to say that you've been seeing some improvement in the reduced COVID-19 count? And if not, what can we expect in terms of a reduced COVID-19 count at the end of this lockdown?
I'm not sure. I think both Jeffrey and I answered that already, and I thank you for the question again. But let me share with you, as I said, the samples and the backlog. He would have indicated that there were 8,355 samples tests done, and 6,560 completed. Clearly, that backlog emerged between the end of January and now Thursday last week, largely as a result of not having the reagent. Since the majority of the reagents came in, and the fact that we had 1 bottle of binding solution meant that how many thousand tests were done this weekend?
Over the last 3 days, we would have done about 4,000,
So
just
just
over
under,
4,000.
just about 4,000 tests were done in the last 3 days, showing you that once we got the majority of the reagents, we were able to move with speed again. We anticipate that we can continue that speed because even the shipment that we got on Thursday is only part of the shipment that the central government paid for week before last, when it was identified out of Canada and the US where we could get some. We're also getting some out of Europe as well, or the UK. I'm not sure if it's Europe or the UK. So that we will have more than enough to keep the sampling and the testing going at a clip. Okay? So I hope that that helps you.
You misunderstood the question. It
No
was
problem.
asking, are you satisfied with the lockdown that we had over the past couple
I'm
days?
not misunderstanding the
In terms of
question at
averages?
all. I'm trying to tell you that I can't be satisfied or dissatisfied until I have an accurate measurement. And until I have an accurate measurement, that depends on us being able to have the reagents and to be able to record on a daily basis truly what our positivity rate is and truly what the R number is. Now, that has been compromised because of the difficulties with the reagents. So that's why I'm not answering the question in the way that you expect. Much will depend on what happens the next 10 days. So I apologize if I didn't make that clear up front. Thank you.
Thank you as well.
All right.
Just a quick question to Dr. Corey Ford. I want to ask about something that has caught the attention of a lot of Barbadians. When last night you spoke about the teething at Harrison Point. What has become of that? Have you had to make any arrangements to try to stamp that out? And has anybody come forward?
Shane, thank you so much for that question. And I'll probably start off by answering this way. And it's simply to say that, it was a quite disappointing scenario for us at Harrison's Point. Many of these things were actually donated to us. And I'm just really imploring Barbadians to understand that the things which were donated to the facility are not just for you. They're for every single Barbadian, every other citizen that really comes on the facility. But to say that, since I've mentioned it, we've asked the police have gotten involved to try to help us. We've had some cameras that we're currently reviewing with regards to that. But to also say that since I've made certainly that notice that I really want to, in fact, one of the two of the PlayStations we found out then were stolen. And I would say this afternoon that, very quick stat, we've had one individual actually stepping forward to donate an Xbox to the facility. So that's a good change for the facility in terms of helping kids. And we continue to ask people to continue to support our facility. It's not my facility. It's not your facility. It's our facility. And so we need to be proud of what we have and use what we have for the sake of every Barbadian. So yes, it is trying for us. These things are often discouraging for the staff. And we will ask for Barbadians who are coming to the facility to understand that we're not only providing medical care, but these things that we have really asked for and corporate Barbados has helped us with to this point actually help with your mental health for the long periods of time that you might be there. And I think this is strategically important.
Dr. Ford, don't you think that maybe perhaps now that we've found out that there's so much pilfering going on, you could perhaps maybe ask the security at the hospital or from some other institution to perhaps help you with some tagging, and a wand or something, so you can actually pick up when these things are being taken through the door, because it is the property of the Crown still.
Yeah, that is indeed true. Wendy, and thanks again for mentioning that. We will and have and currently are putting some other security measures in place. I risk not to discuss them at this type of forum, but you could be assured that this is not going to happen again. So I'm warned Barbadians, if you think about doing it, think twice.
Dr. Ford, question. Some of the nurses at the QEH, they were saying that some of the suspected cases, they're not told that a case is a suspected case, or they're not told that a case is awaiting PCR results. And so even though all nurses should be acting as though everyone has it, some, I guess, did not have their guard up as you would expect, and they're considering it kind of negligence to not have told them that these were suspected cases. Can you speak to this?
Yeah, I really don't mind speaking to this at all, but I think you answered the question yourself. I think that what all countries across the globe have done across all hospitals for countries, certainly which have in-country spread, is to recognize one fact, and that is every single patient, unless you know otherwise, has COVID. And so there, the aspect of universal precautions remains the same, and this is critical. So I think what we really have to do within our healthcare sectors and for any healthcare sector, whether it's the emergency ambulance service, all the way to the hospital, all the way to admission of a patient, all the way to discharge of the patient, is to understand that the precautions that we're supposed to use, you hear me talk about it all the time, it's almost like COVID fatigue. The precautions should always be the same. So irrespective of that scenario, whether you're waiting for a test, whether you're known antigen positive, whether you actually have COVID. So everyone should use the same precautions. And I'll go further to say, even in one of the, I don't want to talk too much about it, but to say one of the major causes of COVID spread within facilities that have been recognized across the globe in terms of hospitals is actually not from patient to the healthcare worker or from the healthcare worker to the patient, but actually the transmission is actually in the staff room. So many of you who are still going to work in your lunch rooms, where do you let your guard down? If you're in a room with 6 people in a lunchroom, I don't know how you're going to eat if you keep your mask on. So that's where COVID is spread. And I think any time that we let our guard down is where we allow this virus to thrive. Like, it's always said, look, people spread the virus. The virus is a spread on its own. Thanks.
May also say, if I may also say that we received a donation of 2 more testing machines at the lab a little while back, and we've dedicated one of those testing machines for the benefit of the Queen Elizabeth Hospital, especially once we realized that the numbers of persons for whom they were asking for tests had increased. We actually were lucky to have an additional automatic extractor as well, but once again, the 2 problems came back down to the reagent. Now that we have that, we are satisfied that the QEH with its dedicated machine, which will be located at the lab, which as you know is only on the other side of the road, but it will stay at the lab because the lab has protective equipment, the biosafety cabinets, etc., which the QEH does not have space to be able to locate, I'm told, and hence the lab will facilitate that dedicated machine for the benefit of the Queen Elizabeth Hospital.
Well, it's good to hear that we're getting that additional equipment. I want to ask a question, and I want to split it between Dr. Bess and Dr. Ford. And this is with going back to the variants that I was asking about. And given that we're not testing at this point for those 2, or don't know that they're actually present, how can we be sure that this spike that we've been seeing in both cases and deaths might not necessarily be attributable to the South African or the Brazilian variant?
Sure.
Carpenter did all the testing, didn't they? But Anton, go ahead. Speak.
Sure, yeah. Thanks a lot for your thought-provoking question, Wendy. One of the things that it's important to appreciate is that whether it's the UK variant, the South African variant, the variant out of Nigeria, or wherever, that the preventative measures that you take are all the same to stamp out the spread of that SARS-CoV-2 virus. It is entirely possible, theoretically possible, that we may have another variant, so I would have alluded to that when I said that we have plans to be able to do genomic surveillance and sequencing at the public health lab. So it's a great question. It's a good theoretical question. We will take the hypothesis into consideration going forward when we build the capacity at the public health lab to do that kind of surveillance.
Treatment for all 3 is the same.
Yes.
There's been it hasn't been demonstrated that AstraZeneca or the other vaccines are not effective against these in terms of those who get severe symptoms. Even in South Africa research where they spoke of AstraZeneca, they insisted that for those who had symptoms, there was obviously reduction in the severe symptoms. The issue with the South African variant was that those who were asymptomatic, it didn't seem to really bother them. The vaccine didn't seem to make a difference.
Is Going forward, as it relates to when you convey the statistics daily, persons are asking if we can get the updates as in per community or parish, know that we are community spread, just like how today you gave with the constituencies, if this is a format that we can stick to now going forward. I know Dr. Ford wants everybody to change their behaviors, and I feel like if people know it's in their parish, it might do something. So I'm just wondering if this is something that can be taken into account when given the statistics each day in terms of the dashboard. And the other question, Dr. Ford, you yourself, you're a health worker, you would understand this plight. Health workers are asking what can be done for them in terms of shopping because their work hours and the supermarket hours are the same. Is there any exemption for healthcare workers or can something be done for them?
I'll take the first question. Thank you for that. The answer from me would be no. And why? First of all, there's no need to overcrowd the dashboard. And then the reality, though, to do that, to do things by parish would give people a false sense of security. Barbados is not like large countries. I mean, there's no, you have people that live in St. Joseph, but when you look at the cars, they are X and E and J and all kinds of things. We are, it is very, it doesn't make sense in that regard because it would give you a false sense of security. The virus is here. We have community spread, and every single community and every single person, every single household in Barbados should recognize that it may well be in their community and operate accordingly. Sorry. What you've asked, sorry, about healthcare workers, and I'm glad you've asked it because it is something that I've started to look at with one or two supermarkets because it has been reported to me. For example, our people who work at the airport, by the time they are finished with their duties, the supermarket is closed, and they are working from Monday to Friday, and they've been experiencing some difficulties. So it is something that we will have to look at, and as I said, I've started to look at it. But the last time when we tried to do this, so many people turned up at the same time that healthcare workers were supposed to have been facilitated that it really did not work. But it's something that we're looking at.
Okay. There are no other questions, I believe. I want to thank all of you for your questions and your participation. And again, to all of Barbados, clearly the fight is on. We have been in pause since the 3rd of this month. Clearly, we still need to continue for some time, and there will be an extension of the pause, and curfew and the directives will continue. We've heard that the lab is expecting to be having all the reagents and binding agents by Tuesday to be able to do the results in a more timely fashion. We're going to pursue more aggressive contact tracing. We are rolling out our compliance officers to ensure that persons adhere to the protocols, especially in agencies and health facilities across the island, and to alleviate some of the work of the COVID maintenance unit. We're going to continue the Seek and Save project, and we're asking you to maintain your adherence to the protocols. And of course, I would want not to finish here without commending the continued hard working and dedicated frontline staff in the health facilities, in the isolation centers, in the polyclinics, especially now as how some of them are also being drawn in to our vaccine implementation project. We're all in this together, and we need to work together, and I'm going to ask the Prime Minister to make her final comments. Prime Minister.
Thank you very much, Jerome. As I sat here talking to you this afternoon, I look at Ilara Court, and here it looks like a studio. I look at the courtyard, it looks like a hospital. I look at the journalists talking to me not from their offices, but from their homes. It is not business as usual. And the only way we can get back to a situation where we can feel comfortable and confident that safe people can do safe work in a safe way and move about safely in this country is by working together. Part and parcel of it requires actions on the part of government. We will do what we have to do. Part of it requires actions on the part of workers in the private sector. I'm confident that for the most part, they are trying to step up to the plate. But we also need every single Barbadian, those who can hear my voice, those who are only hearing it after I've spoken. We really need everybody to step up to the plate. And we believe that if we adhere, and you adhere to the basics, do not go out if you don't need to. Minimize your contact even in your home or in your community, and ensure that in so doing you're wearing your mask. Ensure that you're going to wash your hands regularly or sanitize your hands regularly. And if we're liming and still talking because we want to ease little mental pressure off of our head, I don't need Jeffrey sitting at least 12 feet away from me. Anton is sitting about 6 feet away from me. They can all hear what I'm saying. I could talk serious, I could talk foolishness. I could laugh, I could talk, cry, I could do anything, and they're going to hear everything I say. So human interaction can still take place, but it is how it takes place that we can have control over to make sure that this virus is stopped in its tracks. I want to ask you, therefore, to work with us over the course of the next 2 weeks. It's 11 days from Thursday. Ash Wednesday is Wednesday, and I know that the churches will put a particular effort, not just in Barbados, but globally, in order to be able to remind us what we are about to go into in terms of Lent. I'm asking persons, however, to do their own internal reflection. And believe you me, if 1 + 1 + 1 + 1 + all of us can do it together, then we will get through. If there are people who are hurting, reach out to the church in your area, reach out to your MP, reach out to the community, reach out to whoever you need to. Reach out to your neighbors. Because the kind of people I know in this country, nobody can stand in a district and let people suffer knowingly. That's not who we are. And I'm therefore very confident that in the same way we would have had to band together if we were fighting a war, we'll be doing it now, because this is a war. It's just a war without bullets. It's a war without tanks, but it is a war on how we live and what we do. And the truth is, this virus brings out the best, but it can equally bring out the worst in us. It is up to us to choose which one we want it to bring out. I pray today, I pray tonight, I pray tomorrow that it will be the best in us. But I know that it will only happen with your cooperation and with your willingness to step up to the plate. Thank you, and God bless this nation. God bless each and every one of you. And may we reflect for the rest of today on the loss of those who have gone, but also to say to their families that we hold you up in our prayers, and we hope that with time your loss can be eased. Thank you, and God bless this nation.
Good evening. Remember to be your brother's keeper. Keep safe, maintain the protocols, and as you go into the Lenten season, make a pledge to pay closer attention to the protocols and advising your neighbors whenever you see them breaking the protocols to adhere. Let that be your plan for this Lenten season. Thank you and have a good evening.